Hello, everybody. Thanks very much for joining us. For those of you who don't know me, my name is Peter Llewellyn. I run the services at MedCommsNetworking.com, services for the global MedComms community, by which I mean medical communications, medical education, medical publishing, people who work in and around those businesses. And you'll find lots of resources at MedCommsNetworking.com and the associated services. One of the things we've done a lot over the last few years, we're doing a lot at the moment, is we're providing information about what it's like to work in MedComms and what it's like to work in some of the agencies through the services at FirstMedCommsJob.com, where you'll find all sorts of videos, articles, careers guides, and so on. So today, I'm absolutely delighted that we've got Amanda and the team from Syneos to come and talk about themselves and what life in MedComms is like working for them. So Amanda, I'm sorry, I should say we're going to hand over to have a presentation led by Amanda. We're going to then have a Q&A session at the end. So those of you listening on the day, please use your chat button and your Q&A button to send in your comments and observations. Okay, so without further ado, Amanda, over to you. Thank you very much.
Thanks, Peter. Yes, hi, good afternoon, good evening, good morning to everybody. It's fabulous to see such a diverse global group on the call. Very exciting and very impressive. As Peter's already said, my name's Amanda Smith, and I am the Managing Director of the MedComms division within Syneos Health. And we're going to talk a little bit more about what we do and how we do it as we go through the next 30-40 minutes. I joined Syneos Health just over a year ago now. It's been really quite an exceptional year on many levels. I was very fortunate to get to meet all of the team and work with them for the first 6 months before going into lockdown, which I am eternally grateful for at least getting to know people to some extent as much as you can in that 6 months' time. The latter 6 months has been interesting. I'm sure we'll get some questions about that later. But it's been a really impressive year in terms of the MedComms work and how our clients have reacted very rapidly, as our pharma clients can do when they choose to virtual working, and what that means for their ongoing engagement with healthcare professionals. We've done some amazing work in the last 6 months in terms of accelerating our innovation and our response to our client needs. In terms of what I do as Managing Director, for me, it starts and ends with the people. We have a team at the moment of nearing 70 people. We're on a massive recruitment drive, hence we're engaging with all of you today. You know, we have a people first strategy within Syneos Health, and what that means is I'm there to make sure that my team is fully supported, that they have the learning and development, and we invest in the skills and competencies that they need in order to enable them to fully deliver for our clients a best-in-class service. So that's really what I do. Sometimes, since our finance director is on this call, I also do a bit of spreadsheets and look at numbers from time to time. But mostly for me, it's about the people. And I apologise if I look a bit strange holding my mic to the phone. I'm not practicing to be a pop singer or anything like that. It's just apparently my audio is not very clear. So please put your hand up when I'm speaking if you can't hear me, and I'll probably shout louder or something like that. So with no further ado, we're going to not death by PowerPoint, but we do have a few slides really just to convey, you know, what we do and how we do it. So if we can move to the slide presentation, Becca, and we'll get going. And
see that okay?
I can, that's great. And I think we can click straight
Perfect.
through to our first slide. So you know, in essence, what we talk about to our clients is that we're unique in terms of a healthcare community. We are all about shortening the distance from lab to life. And for us, that's what we do is about faster to what matters. It's our response, our real world response in terms of how we deliver smart responses for our client that delivers to them what they need to achieve. And what we believe is that we do that faster to what matters philosophy that we have, and what we believe is about the full integration of bringing together a diverse group of expertise, subject matter expertise, clinical expertise, all focused in one direction, which is about serving the needs of our clients and delivering on their goals. And we do that with a unique combination from clinical to commercial. Within commercial, we'll hear a little bit more about what that encompasses, but from MedComms to advertising to PR. So we're about, as the bottom orange box says, we're about syncing with our customers and getting them to where they need to. Next slide, please. Oh, sorry, I've gone off the. So we talk about our acceleration model. It's a bit of a mouthful. I'll try and say it without stumbling over it. We talk about the acronym is BAM. It's our biopharmaceutical acceleration model. What does that really mean? It really means, back to what I was saying in the previous slide, that we work to get our clients faster to what matters. We start in early stage in our clinical research side of the business, which I often refer to as big Syneos. It probably represents 60% of our total organization. As you can see on the stats below, we have and are working on 92% of the novel drugs that are brought to the FDA and EMEA, which means, as a career in Syneos Health, you're always working right at the heart and at state of art of current research and development. And our ability to transition and move from that clinical research through to the commercialization with real world evidence, moving into deployment solutions where we have a division that enables us to partner with pharmaceutical companies in terms of helping them engage with their customer base. And then the full commercialization model, which is where we sit in terms of communications. And we have our sister agencies that are specialized also in PR and in advertising. We are global. As you can see on this slide, there isn't a part of the world really that isn't represented within Syneos Health. We span more than 6 continents. What this means when you come to work in Syneos Health is that you get a rich tapestry of cultural working. It's not unusual to be, based in London or in our Manchester office, but working with people in New York or Boston, in Australia, wherever. And that's a great opportunity, and certainly something I really enjoyed as I grew up in my career in terms of understanding that cultural diversity and how we all work together and communicate together. We have, therefore, a very diversified customer base. This slide is really talking about our clinical research side. It reinforces the large number of studies, the significant amount of sites that we've got, and the number of patients' lives that we're touching on a daily basis is significant. And that means that we have a very wide-ranging therapy area expertise. And, just within our MedComms division alone, we have a lot of oncology business, but we also have neurology, fertility, gastroenterology, cardiovascular. I'm trying to think what else. I'm sure I've missed some because I generally do within, just within neurology, for example, we are spanning 4 or 5 different sub-therapy areas within that. So it is an exciting and very broad-ranging group of therapy areas. Alex.
Thank you, Amanda. So as you've heard already, our business supports the entire drug development and commercialization process. So we have dedicated teams at every step of the process, and this is integrated at the highest and lowest levels. So our integrated model brings business strategy to science and scientific expertise to business, creating a higher likelihood of success for our clients' products, for their assets. So we aim to address the new market realities through clinical and commercial sharing expertise, data, insights, and we hope to meet the needs of global biopharmaceutical firms of all sizes. So we work with small, mid, and large pharma. We do our best to make our solutions innovative, integrated, and provide our clients with a critical competitive edge. So that's providing us the critical competitive edge to support our clients, but also giving them the edge to ensure success for their product. As you can see from the, sorry, if you go back a slide, sorry. As you can see from this slide, MedComms sits directly in the middle of this detailed slide. So we've split this slide into 4: clinical, regulatory and medical affairs, market access, sales and marketing. And MedComms here supports all aspects of medical affairs, from medical strategy and stakeholder engagement right the way through to congress support and training programs. In MedComms and medical affairs, we aim to be the conduit between clinical and commercialization activities, for example, market access and marketing. Thank you. So for all of this to work for us and for our clients, we aim to bring this together with a top-down integrated strategy to ensure all commercial channels are aligned. We aim to bring together medical, market access, creative, PR, and commercial strategy, as you can see from this slide. So essentially, it's ensuring that everything is aligned at the highest level, as I mentioned before, and we align things from the scientific platform, the value proposition, unbranded positioning, and then the branded positioning, the branded campaigns.
Thanks, Alex. So as Alex just said, we have a wide integrated commercial offering. And if we drill down a bit further, within this commercial team sits our communications team in Europe, and we are made up, as it says here, of MedComms, public relations, and advertising. And our business is supported by central functions like our creative studio, our digital insights and analytics team, and our BD team, or our business development team. And we have a number of clients and accounts that sit across these 3 disciplines. So we truly do live and breathe this integrated comms offering every day, creating what we like to call an omni-channel experience. And what that really means is that we provide our clients with multiple touch points over a variety of different channels, which ideally seamlessly connect, allowing our customers to sort of pick up where they left off from one channel and continue their experience on the next. So with that, if we go deeper still, and look specifically within MedComms and what we provide day to day and what our team provides day to day, we provide end-to-end medical strategy expertise, from early market preparation for a product pre-launch, ongoing all the way through to post-launch ongoing commercial activities. And as you can see from this slide here, development of scientific comms platforms, as Alex alluded to earlier, and publications plans usually come earlier in the product lifecycle, whereas congress and symposia activities, competitor analysis, and real-world evidence studies and activities around that usually follow later in the product lifecycle. So again, the clients and the accounts that we have really mean we do have a variety of projects in our portfolio, and we cover all of these sort of traditional MedComms activities. My slide isn't advancing now. Here we go. So what does this mean for us, for those that work at Syneos Health every day? So all of the services and activities that we've just mentioned are delivered by us, the people at Syneos Health, and we are driven by 3 core values. So the first is to challenge the status quo, and a lot of us in MedComms come from a science background, and it is innately, I think, ingrained in a lot of us to be curious. And so this value really does resonate with a lot of us day to day. And I think the guys on this call will speak to this a little bit more later. The second value is passion. And ultimately, we are a healthcare company, and it's so at its core, we are here to provide better solutions for patients and ultimately change lives. This inevitably inspires us all, and is again a big reason why all of us come to work every day. And finally, The third value is to collaborate. So I think we've kind of each already individually spoken to this in the first few minutes of this presentation, and I'm sure we'll touch on it again when we come to Q&A, because I think it does distinguish us as a company, and for a lot of us, again, is why we work at Syneos Health. This team is so clever, and there are so many experts to leverage across the company. There really is a sense of people wanting to share knowledge across departments and across the wider company, which allows us to be creative and innovative in the solutions that we are providing to our clients. And it really, I think, is what sets us apart and enables us to be successful. So with that, I'm just going to finish on the last slide, which is the email address for our HR department, if for what you've seen so far looks good, and we'd love it if you could drop us a line here for any further information about the company, or if you're looking to join. With that, I'll hand over to Peter.
Excellent, cool. Thank you very much. Thank you very much. I hope that people listening, certainly anyone who's regularly listening to these, is going to understand this is you're quite a different MedComms agency to some of the others that we've had online. And that's what I'm trying to do at the moment, is find a variety of you to talk to us about. Can I just start by just exploring a little bit more what I'm thinking there? You've talked about how, and maybe I'm looking at Amanda at this stage, but you've talked about how it's very international. Syneos Health is very international, and it's a big company. And Syneos Healthcare Communications is within that, concentrating on MedComms. Yeah. Can I just clarify, Syneos Health Comms, which is your part, how international is that? Have you got health comms people in all those different offices all over the world, or are there key places where you're based as opposed to the Syneos Health organization? Do you understand what I'm saying?
And you're talking about the MedComms global footprint, I think, and the communications global footprint, as opposed to
the broader,
broader. So yes, we do have a global footprint, and it's a strategic driver for us going forward in terms of building that global footprint. Right now, we have a significant footprint in the UK. So the UK or EU communications team, as you've seen from the slides that Becca presented, span those 3 disciplines. We work with global pharmaceutical clients, and also at a regional level. We tend to do a very limited amount of UK work, certainly in MedComms. We barely do any. We also have a MedComms team in our US offices with a sister agency there that we partner with. And we do have other external partners in Asia. But certainly moving forward, it's a strategic driver for us to continue to grow that global footprint. And with that comes, which is probably where you're coming to, is the opportunity also for people to move around. So you could join the team in London, and there may be an opportunity coming up with our New York sister agency, and that is certainly for us in terms of a people first strategy, is being able to give people that opportunity to experience other cultures, other working environments, other types of projects.
Okay, I was also coming at it from a slightly different point of view in terms of, especially as we have an international audience online at the moment. Is it as simple as saying wherever in the world you are, you could work with us? I presume it's not as simple as that. And also if someone's in Singapore or something, they can't work with you in the UK. So I'm just trying to get this sense of if you're based, and we did have one question that came in overnight about whether you're recruiting in Morrisville, for instance. I'm just trying to get a sense of, where people can find those opportunities if they're interested in MedComms, whilst maybe encouraging people to look beyond MedComms, because you're part of a much bigger organization. You see what I'm saying? Yeah,
I do. Yeah. So yes, you can work in MedComms in some areas, and other areas you can't. So yeah, you're right. At the moment, it would be probably very challenging for us to put a MedComms person in Singapore, but certainly in the US, we have several offices there. And any opportunities are always advertised externally on our careers website. We also have offices in Europe, so a bit closer to home, in Germany. So again, there's opportunity to to work in Germany.
Okay. I see. It just covers off an inevitable question that will come in.
Yeah,
okay.
Sure. Yeah, that.
Okay. And as part of what you've said, which is one of the differences, say you versus some of the other agencies, all this stuff going on around you, clinical research and all the rest of it, which is interesting and an opportunity. But also you've got clear advertising, PR type arms. Again, just give us a sense, all right, at a general level. If a project comes in. I suppose what I'm trying to get at is, does it work seamlessly? I suppose you'll tell me it does. If a client wants to work, there's a mixture of projects, which is bit advertising, bit of PR, bit MedComms. How does that work within an organisation like yours? Does it depend on how it comes into the business? How do you all work together? It's one thing saying the ad experts are over there, but also they might be busy doing something else. So how much? I just want a sense of how it works in a multi-faceted organisation like yours. Do you see what I'm saying? And again, yeah. Amanda, just lead us on that one briefly.
Yeah, I'm going to start, but I'm actually going to probably pass over to Becca as well, because she has been leading on one of our main integration accounts. Yeah. So I think it'd be good for her to. So I'll give you a bit of thinking time, Becca. So I've just done that question on you, but yeah. So for me, I've worked in a lot of other networks where and they all talk about integration. I think because of that acceleration model that you saw that slide on at the start of the presentation, I think that's what makes, for me, Syneos stand out differently, that it is a seamless moving part, that a molecule goes through a clinical research program and ultimately ends in the commercialization box. And the way that we are structured within Syneos Health enables us to seamlessly take that molecule from research, just as a pharmaceutical company would move it from R&D into medical affairs, into marketing, into market access, etc. We are set up in exactly the same way to be able to do that with our clients at any time that they want. And again, it can often come down to how does that integration actually feel like when you're working in it in an agency. And I've had some really good experiences, particularly at Syneos. I've had some frustrating experiences, and it often comes down to how that translates in terms of internal financial application of it. But for us in Syneos Health, it is a fully integrated approach, and it's a and it talks to some of the values, the values that you saw Becca talk about. That collaboration value underpins the whole culture within Syneos Health. That drives, I think, how we integrate. But Becca, perhaps you could bring that alive a bit more for people in terms of you've lived that and breathed it for a good while.
Yeah, absolutely. So I currently work across 3 different accounts in portfolio 1 within the MedComms team, and they're all very different from each other and pose different challenges and opportunities. For me, I think also personally to develop as a person, and that's one of the reasons why I'm still at Syneos Health. And so the first one is a small oncology account, and actually it's something that I work with Eoin on. So that team's made up of 3 or 4 of us, so it's a small team. And this account has been particularly interesting for me recently, because we're working very closely with our market access and consulting colleagues to put forward some integrated proposals and ideas for business development for this particular client. So they actually reached out to us to ask us to put together a uniformed, proposal, and we've spent the last couple of months working with them very closely in partnership to prepare some slides that they could actually eventually share with their board and their investors to get those activities signed off across that integrated sort of platform of activities. So that's one example. And then one of the other, my second account that I'm working on at the moment is a small infectious disease account. And again, this is a new one that I would like to personally establish and grow. And this one's particularly interesting because I am working very closely with the advertising team who have delivered a couple of activities already for this particular client. And then we are working with what we call an integration lead. So it's someone who's an employee of Syneos, but is employed by the client to work for them full time to essentially join the dots and pull on the various departments for when their expertise is needed. So it's that central Syneos person then becomes sort of the middleman for reaching out to us as and when needed. So that's again slightly different in how that integration works. And then the last account that I work on is a big one for us in MedComms, but not just MedComms, but also within the advertising team, just in our London office. And it's that's an account I've worked on pretty much my whole career at Syneos, about 7-8 years. So it's an old account for us. And it's as I said, I think this is one where we live and breathe integration within the UK London office with our advertising team. So that's anything from just thinking, so our advertising team's working on their branded HCP campaign, and then we are looking more at their obviously traditional MedComms activities like HCP training decks, doing webinars, symposia, congress, standalone meetings, and all of that good stuff. So yeah, I think that's just my experience, but across all 3 accounts that I'm working on, they are all examples of integration at work, I think.
Okay, thanks. I think it's worth talking about that because it is different to some of the other. I keep coming back to this point, but I think too many people look at MedComms and go, I want to be a medical writer in MedComms, and you're all the same. I just need to get in. And actually, you're all quite different. And what you've been talking about there is quite different to the way in which some of the other agencies work. So thank you very much, because I think that was well worth it. And can I just move us on a little bit? And I hope I'm not going to get this wrong, but I'm going to try and sort of lead myself in a direction here. Becca, you're a medical education consultant, I think is your title. Is that right?
Correct.
Okay.
Yes.
Right. And Grace, you're also a medical education consultant. Is that right? Can I bring you in on this one?
Yeah,
okay, so I got that bit right. Okay, so just to sort of hand the baton to Grace a little bit, because we talk about writers, account managers, whatever. What's a medical education consultant? Just give us a little bit of a feel in your terms of what, why are you called a medical education consultant as opposed to something else? Just to give someone a sense of the different terminology and the different responsibilities. Yeah, does that make sense?
Yeah, that's fine. So a medical education consultant is the title that we all have, that we share with our clients, to show that we all work together. But within that, we all have our job title. So I'm a senior account executive.
I see. Okay. Right.
Yeah. So we all have that medical education consultant role for our clients, but we do have those job titles.
Okay. So guys, I got that wrong then, didn't I? Basically, you're all nodding at me, but actually I'm completely wrong. So medical education consultant isn't a sort of a job title. It's what you all are. And then you've got individual titles. So Alex, before you jump in, Grace, you've just said you're a management type on that side of the business, senior account executive, you say?
Yeah.
Okay, Becca, just come back to you. Just clarify then before we lose you. What's your title? Are you writing or account management or what?
I'm also sitting on the account side, so I'm a senior account director.
Okay, excellent. Okay, Alex, you were trying to come in. You're also on the account direction side, is that right?
Yes, so my role is account group director, which has a similar but slightly different role to a senior account director. And what I wanted to say was the medical education consultant is really to empower people at all levels to have an equal voice across the board. So people at a senior level chip in and do roles which might historically or in other agencies be isolated for an account executive, for example, and vice versa, if there's a need, and vice versa, an account executive has a voice where they can share ideas and input on things, again, which might historically in the other agencies be reserved for those strategic leads of the account. So it's really an empowerment title rather than official job titles where we set by it, because naturally everyone is at a different level in their career, and this is a way to bring us all together and make us feel as one.
That's great. I'm going to try and turn this into a positive, my embarrassment about getting it wrong into a positive, and say, the titles, and it can be confusing from the outside, and indeed from my point of view, in terms of job titles that are thrown around so on. And that's one of the things that, again, I think is useful in these discussions to bring out these sorts of differences, so that if people are listening to us, they can start to tune themselves into this sort of thing. Yeah. What I was going to say, I was going to come back to Grace, if I may, because I keep bringing Grace and then Eoin, if I may, since you haven't had a lot of airspace at the moment. Let's bring you in on this. But Grace, let's start with you. Can you just give us a little bit of background? Someone's just asked the question actually very specifically. Just give us a little bit of sense of what your journey into the current position has been.
Yeah. So I first started working in MedComms when I joined Syneos Health in 2017. So just over 3 years ago. I started as a temporary worker, so as a quality and process consultant, but that essentially meant supporting the different teams with admin tasks. So actually that was a great first role for me, because I'll admit I didn't know anything about MedComms when I first started. I actually didn't do a science degree, so I don't have a science background, but I was looking to work like in an office for a people-focused company, and that's why I joined Syneos Health. But the role that I started in helped me to get familiar with MedComms and the different types of accounts and clients that we work with, because originally I wasn't assigned to a particular account. I sort of helped everyone throughout the team, which was a great way to get to know everyone and the different accounts. And then I got offered a permanent position and promoted to graduate, and I completed the grad scheme at the end of 2018, beginning of 2019. So I did that. I think Becca completed the grad scheme as well, so maybe she'll be able to share some insights on that. But yeah, now I've been moving up to senior account executive. Yeah, that's how I got into MedComms.
Okay, and it's worth making that point, because again, it's always worth making this point. You didn't have the life sciences background, although overwhelmingly, in fairness, a lot of people will have if they come into MedComms, but you're on the account management, project management sort of side. Eoin, I'd like to bring you in as the writing representative here. Can you just say a little bit about your background, how you came into this, and give us a sense of how your role is different from Grace's thing?
Yeah, sure. Thanks, Peter. So I was undertaking a PhD in evolutionary biology, very different to some of the other backgrounds that many other writers may have, such as in pharmaceutical or other medical science disciplines. So after my PhD and some postdoc experience, I was just tired of long weekends and evenings spent in laboratory. So I was looking for a change in career, and after some research, I decided that medical writing was the best place for me to utilize the skills that I'd developed after a couple of years in academia. So prior to that, I worked a little bit in laboratories and pharma companies. So I had an awareness of the wider industry. So after some initial research on how different types of roles, as I said, I fixated on medical writing, got into the game about 4 years ago. Worked for an independent agency for about 2 years, and then I've been with Syneos for about 2 years now.
Okay. And to put it simplistically, Grace is doing the account management, the project management, the financial management sort of side of an account. You're writing, you're developing content. I mean, I know that's very simplistic, but one of the points I would then immediately make is that if anyone's watching this, a medical writer doesn't just sit in a cupboard writing. You are part of the team. There's a lot more that comes with it. Just give us a sense of that, yeah?
Sure. So the role of a medical writer is essentially to facilitate the scientific exchange among HCPs and other stakeholders. So we do this by developing peer-reviewed source references, and this can be either writing manuscripts, conference abstracts, posters, or live presentations, but I also develop other materials associated with the marketing of products and internal training materials for pharma companies. And this is to kind of educate internal staff within these companies on the science and ensure that their internal audiences are kind of aligned with external messaging. So there's quite a breadth of different types of projects one can be involved in. But like what you say, you're quite often not tucked away in a corner because of the types of clients I've worked with. Whilst at Syneos Health, it's allowed me some opportunities to travel abroad. I've been to Brazil, Spain for internal and external training events where a medical writer's experience or expertise might be needed on the ground. So there's loads of opportunities for exciting branching out, so to speak.
Excellent, excellent. And as soon as you mentioned Grad Scheme, Grace, we had a couple of questions that came straight in. And you mentioned Becca's been through it. Can you just give us a sense of what that means in Syneos? What is the Grad Scheme? And a specific question, does it apply to both the account management and the writing side? So just say a few words about the Grad Scheme and I guess how people would apply for that and how it works.
Yeah, so it is for.
Oh,
both.
sorry, I was going to bounce that back to Becca, Grace.
Oh, no, go on.
Tell me by surprise. I don't mind, but Becca, you've been through this, haven't you?
So yeah, it's actually topical because I actually got the privilege to judge the grad presentation for this year's cohort yesterday. So that was really enjoyable to be a part of, and actually. It was the group that I had also been part of the selection process a year and a bit ago. So it was nice to see that full circle as well. And yeah, as Grace mentioned, I was part of the Grad Scheme 7 years ago now, I think it was. So it was a long time. I'm sure I think it has actually evolved and changed a little bit since then. But it is for everyone. It's not just for MedComms either. It's open to our PR and advertising colleagues as well. So it's delivered sort of centrally for all of those business units in the UK office. I think that's worth pointing out. And it's usually made up of a series of I think it's about 6 to 8 sessions given by an external trainer who has delivered all the grad program for the last, I don't know how long, 8, 9, 10 years, I think. And as I said, it finishes with a sort of mock pitch presentation. So the grads are split into 2 teams and essentially pitch their ideas for a real live client brief. And we on the judging panel get to give them our feedback on how they did. And usually if we were in the office, there would be a celebration and a party afterwards. But unfortunately this year, that was slightly, well, it didn't quite happen the way it normally would.
It was online.
Yeah, virtual drinks, I think, were had. But it covers a whole host of different things. So there is a session, for example, on press releases and kind of more the content side. And then there are general sessions about time management. Grace, what else is there? You've done it a little bit more recently than I have. I'm trying to remember everything now.
Yeah, so it was a bit of a mix. We also had people come in from the from the creative team, from PR, from ad to talk about the different functions that we have within commercial. I think there was like one about your communication styles, and we did a lot of like exercises as a team. But yeah, it was good fun.
Okay, great. And can I just ask again an obvious question, which is hinted at here? Is that the way into Syneos? If you're entry level in MedComms, do you come into this grad scheme, or are there different ways in at different times? You see what I'm saying? Alex, let's bring you in at this point.
I would say that there are different ways in. It depends on the level of experience you have in general. So as Grace demonstrated with her experience, for example, that she came in with a desire to work in MedComms, maybe not necessarily knowing what MedComms was, but wanting to know more, and then worked her way up into the graduate scheme, and then has flourished since and worked her way there. And other people with a maybe more of a scientific background at undergraduate level would come in at a grad scheme. But then it's people with PhDs or masters, or if they have experience within MedComms or even within communications, they can come in at different levels.
Okay,
So
that's an important message, I think, to get out there.
It's not the only way in a nutshell.
Okay, cool. Okay, I've got an eye on the clock as always with these things. I'm always running a little bit over time, and I just want to touch on and maybe come back to Amanda if you don't mind. You know, we face up to the fact we're in November 2020. You know, we're in lockdown in the UK. You're an international organisation, so you've seen lockdowns all over the flipping place. Just give me a sense of how it's working. You know, I keep saying MedComms is still open for business. You know, this is a business that's been actually moving quite quickly towards a very flexible way of working. But what's happened this year has pushed us very fast. But just give us a sense from your point of view within Syneos, how you're doing. Are you bringing people in during lockdowns, the training and so on, the onboarding? Just give us a brief sense and then we'll wrap this up for the recording.
Yeah. So yeah, it's very much doors are open and it's business as usual. I mean, I think for anybody who joined a bit earlier, we were having this discussion at the start. You know what, we went into lockdown mid-March. It was probably a week or so ahead of the government guidance and the full official lockdown. I won't, you know, I won't wrap it up. It was very challenging for all of us, I think, in those early weeks. Our clients went very quiet for probably about 4 to 6 weeks while they were obviously working out what they were going to do and their congress planning and their, you know, external engagement and things like that. But they, you know, and classical pharma way woke up with a vengeance. Mid to late April, repurposed all of their standalone or, you know, activities that needed that physical environment to virtual online, and we accelerated, as we do very well, into virtual meetings at a pace and a speed that we would never have done if we hadn't have had this pandemic. And I think that's, you know, for me, been one of the plus sides in terms of coming out of, you know, in terms of our ability to innovate and to show just what we can do. I think at a personal level, I think it's probably it's been a very different, I hate the J word, but I'm going to use it, very different journey depending on, you know, where you are in your career. We have MedComms is a young person's environment. So we have, you know, people like Grace and Eoin and lots of others who live in London in flat shares, who, you know, join an organization like ours because, as Eoin said, you know, one of the reasons he wanted to join Syneos Health because we had a hip hop office with a fab open area, kitchen, lounge area where, you know, you get a lot of socializing, and that's really important to have that. So, you know, I think for that our 20 to 30-year-olds, I think that, you know, if I'm going to do market segmentation, I suspect, you know, I know it's been quite challenging, and there's 4 of you in a flat share sharing a kitchen table and you've got to be on client calls, but, you know, it's people have worked through it. And I think, you know, back to our collaboration and our culture of being there for people, we've had, you know, it has been a recurrent and continues to be a recurrent theme, which is to look out for each other, you know, be aware of your own self. If you hit a roadblock of lockdown or whatever it's causing on you emotionally or whatever, your resilience levels are running low, you know, take some time out. If that means take an afternoon off and just switch off from the world and you need to do that, then do that. So there's been a lot of learning, I think, about how we've all built our emotional resilience, and being on a webcam, you know, for 8 hours a day, it's a very different style of communicating, and it took some, you know, it was very exhausting, I think, for all of us in the early days, but like, you adapt, don't you? I think the challenges has also been for people is that, you know, the blurring of the boundaries of, I'm leaving the office now and I'm going to the pub with my mates, or I'm getting the train home or whatever, and that sort of demarcation piece of, I've now stopped work. So I think also for us all, it's been about having to learn how to work from home, and perhaps set some personal boundaries. I, for one, have had to put a lunch break into my day, which I've never ever done in all of my career, really, just because 6 months of working remotely, I just found I wasn't getting up from my chair at all, you know, apart from a break or whatever and a coffee. So, you know, however seasoned you are, or however long you've been in your career, I think this whole working remotely has been a learning for us all that we'll take forward. Another plus that we've seen, there's two other pluses really I want to make. We have writers who are also not within the UK, in India, and actually integrating them into our business because we're all virtual has actually facilitated and accelerated that much simpler, I think, than it perhaps would have been if we were office bound and in that slightly different environment. It just naturally, we're all virtual, so it doesn't really matter where you are, so long as you're aware of different time zones. And then the final piece, which I think has been great, and I hope we don't lose it, is the relationship with our clients actually has, I think, become stronger. And I think that's to do with the informality of, you know, being in your own home, you know, the menageries that people have got, the doorbell ringing, the whatever that happens. This is just, and just having that window into other people's personal lives has sort of broken down some barriers that were there that perhaps you weren't quite so aware, and clients have become much more accessible in this virtual working world than I've ever found them before. So there's lots of goods, you know, that's come out of this virtual working. But I know we're all keen to get back at some point for some physical contact.
Yeah. Okay. So, but it's a positive message. So, what I'd like to do, as I said, I've got an eye on the clock and we're over time. So, can I just say a huge thank you to you guys for joining us today. To those of you who are listening to us online at the moment, don't run away. We've still got 10 minutes or so, and there's a couple of questions, good questions, I'd like to pick off there. So can I just finish the recording, as it were, by saying huge thanks to you guys. I know I'm talking for you, but I don't think anyone will disagree. You'd love to hear from people via LinkedIn or whatever. People can reach out to you. And you, can you actually, this is putting you on the spot. Who's going to do it? What was that email address from, if anybody's interested? Who's got it in front of them? HR
London. HR at syneoshealth.com.
There you are. What a star. There you go. Okay. All right. So thank you very much. I'm going to wrap the recording up now. It's a thing. Bear with me while I turn the recording off. Just everyone wave and say goodbye. So bye-bye.